Hello guys, so my name is Dr. Abid. Today we will learn about a lecture which is called hematopoiesis. Hematopoiesis is a process by which blood cells are made. So this concept is very important in the histology section, immunology section, as well as hematology section and the embryology section. So we have to learn it very carefully, and we will learn step by step all the things which include in hematopoiesis. So first thing first, we have to define what is hematopoiesis. Hematopoiesis is a process by which blood cells are made. So like RBC, WBC and platelets, which are made by the process which is called hematopoiesis. In embryonic life, like this is I'm an embryo. In embryonic life, this is little I made a yolk sac. So in embryonic life, in the yolk sac, third week of gestation, hematopoiesis is occurring. So after that it will shift into the liver, lymph node and spleen at the third month, and at the fourth month it will shift into the vertebral column. So this is very nice picture to remember that. Another way is to remember that I have a mnemonic for that young liver synthesize blood. So Y is for yolk sac, liver is for liver, S for is for spleen, and B for is for bone marrow. This is a sequence I have write down that hematopoiesis is occurring. So you have to remember just these weeks. So at the third to week to 8th week, hematopoiesis is occurring at yolk sac, at 6th week to birth in the liver, and 12th week to 28th week in the spleen, and 18th week to birth in the bone marrow. Sometime in the questions, step 1 question, they ask this thing that either student remember or not. So that's very important to remember that. Before I am starting hematopoietic lecture, I just want to give you some definition so that it will be easy for a student to remember the whole process of hematopoiesis. So we will go step by step. So for the first term is our what is extra medullary hematopoiesis. So we know that is bone have a medulla. If hematopoiesis is occurring in the medulla of the bone, so that is called intramedullary hematopoiesis. But extramedullary hematopoiesis is the hematopoiesis which is outside the medulla occurring. So that hematopoiesis is called extramedullary hematopoiesis. So in full term, newborn baby have a extramedullary hematopoiesis. If that occur, that is abnormal. So what we learn that the all hematopoiesis in the newborn will occur, that is intramedullary hematopoiesis. So this is the new definition which we come across, that what is stem cells. Stem cells are those cells which give rise to the different kind of hematopoietic cells, and while they are giving rise to the hematopoietic cell, it will maintain its populations. Like they are giving erythroblast, they are giving myeloblast, myelocytes, they are giving, for example, megakaryocytes, they are giving like granulocytes. So while they are giving different kind of cell, it will maintain its population. Like this stem cell will not vanish, it will be there for another lineage. So for example, I give just one example, that these stem cells divide into erythroblast, and erythroblast eventually goes to the develop in RBCs. So that is very important to remember that. So type of stem cells, how many type of stem cells are there? We have to remember just four types, like totipotent stem cells, pluripotent stem cells, multipotent stem cell, and committed stem cell. So it's we will go one by one in next slides, so we don't have to worry about that. What is totipotent stem cells? Totipotent means that stem cells have a totipotent. Toti means total potentials. So stem cells which have total potential to give rise any kind of cells, that any kind of cell, that is called totipotent stem cells. So that's very easy. So while it's giving rise to the any kind of cells, it's maintain its progeny. That is what is totipotent stem cell. Totipotent means have a total potential. That's very important to remember. So pluripotent, next our definition is, what is pluripotent stem cells? Pluri means not all but many. So pluripotent means that stem cells which have capacity to give many kind of stem cells. We have to remember this word, like many kind of, they give rise to the many kind of stem cells. Pluri mean many, not all. So those cells which give rise to the many kind of cell, they are pluripotent stem cell. Now our next definition is, what is multipotent stem cells? Multipotent stem cells are have a like multiple potential, that they give rise multiple cell, not all, not many of them, but multiple cells, we can say that. And the last and final is committed stem cells. Committed stem cell, for example, I give this very nice diagram. We have, for example, this is a one cell. This cell is like, we can say that that is erythroblast stem cell. This erythroblast, when it divide, it give rise to the two cells, two RBCs, one RBC here and the second RBC here. So while it give rising to the RBC, two RBC, it commit itself, it will not maintain its original form, or like say that original cell. It will divide into two different kind of cells, and it will not maintain its own presence. Like that cell is called committed stem cell. So this, we can say that this is like, I think that that is a pseudo stem cell. So we have to remember that. So we said that all these stem cells that divide into different kind of hematopoietic cell. So these cells need some factor which can help in division of those stem cells. Those factor are called soluble factor or growth factor, like erythropoietin, thrombopoietin, granulocyte monocytes, and colony forming colony stimulating factor. So these three important factor, those are called growth factor or soluble factor, which need in growth of stem cells. We have an injection of erythropoietin. We give the injection of erythropoietin that help in erythropoiesis and other hematopoietic stem cells growth. I have seen I have seen erythropoietin in the dialysis center. So patient have in the kidney diseases, patient had deficiency of erythropoietin because our kidney have capability to secrete the erythropoietin so in our blood, so it maintain the blood cells. So this is a fun uh, diagram. So this is the actual, now we starting a actual process of hematopoiesis. So this is a very easy diagram which is I made by hand. So this is a one cell which is called pluripotent stem cell. We know that pluripotent mean have a potential to give many kind of cell. Then it will divide into multipotent stem cells, and then it will divide into committed stem cells. We already discussed that, so that's very easy. So pluripotent stem cells, what is pluripotent stem cell divide into common lymphoid stem cells and common myeloid stem cell. These two lineages give rise all the hematopoietic stem cells. So first we were gonna discuss about the common lymphoid stem cells. So let's start. Common lymphoid stem cells give rise to three kind of cells, like pro natural killer stem cells, pro T cells, and pro B cells. So these cell will go into the blood from the hematopoietic home where the hematopoiesis occur. Like we can say that in example that in the medulla, like bone, in the medulla hematopoiesis is occurring, so that those cells, pro natural killer cell, pro T cell, and pro B cell, that will go into the blood, and from the blood these T cells go into the thymus, where they mature and again come into the blood. So I want to discuss more about these T cells. T cells can be divided into two major cells, like T helper cell and T cytotoxic cell. What is the difference between in these two cells? I can say that they have a different protein on them. So that is a major difference, that like they have a CD3 and CD4 protein on the T helper cells, and CD3 and CD8 protein on T cytotoxic cell. TCT means cytotoxic, TH means T helper cell. So that's a major difference between two of them, and we will study more about the immunology section these cells. So T helper cell can be divided into T helper 2 cells, T helper 1 cell. So T helper 2 cell help the B cell to mature into the plasma cell. What is the plasma cell? The main characteristic of plasma cells, they secrete antibodies. So they secrete antibodies, so T helper 2 cell will help in those B cells. And what is the function of T helper 1 cell? T helper 1 cells help in maturation of monocyte into macrophages, big eater. So they help in maturation of epithelial cells, like thymocytes. We will discuss it more in next lectures. And other monocytes which join together, and they give rise to the joint cells, which are multinucleated. 1 2 3 4, they have a 4, like many nucleus, not 4, we can say that. So that's very easy, that lymphoid stem cells give rise to the three kind of cell: natural killer cell, T cell, and B cell. It's very easy. So next slide we will discuss in common myeloid stem cell. So this is our common myeloid stem cells. This is very important because The above three cells, common lymphoid stem cell, we will discuss in the immunology section, and we will discuss all of thing related to those cells, how they work, how they differentiate with each other. So here in the hematopoietic lecture, we will mainly we will discuss these common myeloid stem cells, all those, how they divide. So let's start one by one. So common myeloid stem cells, they give rise to three major progeny. They give rise three major kind of cells, like erythroid, megakaryoid, and basophil. So granulocytes and monocytes, uh, those. And third is colony forming unit, eosinophil, and erythrotic primitive cell, sorry, not premature, erythrotic primitive cell. So this is very important, that colony forming unit, erythrotic primitive cells, because from the name we think that this erythrotic primitive cell give rise to the RBCs, but they don't. They give rise to the eosinophils. So let's study the one by one. Erythroid, megakaryoid, and basophil lineage, they give rise to the three cells, like colony forming unit erythroid, colony forming unit megakaryocyte, and colony forming unit basophil. So colony forming unit erythroid, we know that they give rise to the erythroblast, which eventually give rise to the RBC, which is we call erythrocyte. So here I want to discuss that what is blast cells and what is erythrocyte. Erythrocyte are side cell. Sites mean which are cells which are mature, and blast means still they are baby cells, like that's why they are called blast. So erythroblast, they are baby cells, not fully mature, but they when come into the blood, they become RBCs, which is called erythrocytes, also called erythrocytes, and they are mature cells. So the second is megakaryocyte or megakaryoblast. Here in the blood vehicle, megakaryocytes are platelets, so they give rise to the platelet. And third is basophil. Basophil are when they come into blood, they are like mast cells. They have a receptor for IgE. That's very important. The second lineage is granulocytes and monocytes. We already discussed that. Second, they give rise to the granulocytes give rise to the myeloblast. So myeloblast eventually give rise to the neutrophil. Look, they have a multi-lobe nucleus. So they give rise to the neutrophil. And monocytes are they give rise to the normoblast, and normoblast give rise to the monocytes mean macrophages, big eater. We will study all those cells in next slides of the hematopoiesis. So eosinoblast, which is derived from the colony forming unit. Eosinophils are erythroid primitive cell. They give rise to eosinophils. They have like this bilobe nucleus and red granules in them. That's why they are called eosinophils. They pick red dye. At the time of birth, all the hematopoiesis will occur in the bone marrow. That's very important. So type of bone marrow, how many type of bone marrow is there? There is a red bone marrow and yellow bone marrow. So what's the difference in both of them? First is the color difference, that red bone marrow have a red bone marrow and yellow bone marrow have a yellow bone marrow. So what other differences there? The red bone marrow is an active bone marrow which is actively dividing into the different kind of hematopoietic cells, and yellow bone marrow is the bone marrow which is not actively dividing. So they have a lot of like fat cells. That's why they are called yellow bone marrow. but yellow bone marrow can be changed into red bone marrow when there is a need of a lot of blood cells, so they can be changed into the red bone marrow. That's important. So histological study of the bone marrow, how we will gonna study the bone marrow? We have a basically two method, that bone marrow aspiration and bone marrow tryphin biopsy. How we gonna do that bone marrow aspiration? Bone marrow aspiration, we take the bone marrow from the sternum or the anterior iliac crust or the posterior iliac crust. We put in needle into the sternum or the anterior iliac crust and posterior iliac crust, and take out the bone marrow. This fresh bone marrow and then apply it to the slide and produce smear to study them. So bone marrow tryphin biopsy, how we gonna do that? Usually we take from the posterior iliac crust, and differences between the bone marrow aspiration and bone marrow tryphin biopsy, that we fix in the bone marrow in tryphin biopsy and decalcified it, and when it decalcified, so so after decalcification we study, and histopathology of the bone marrow can be understand with the bone marrow tryphin biopsy. So bone marrow stem cells can be divided into hemangioblasts, into the liver cells, into the biliary cells, into the myocardial cells, into the muscle cells, and into the neural cells, and into the glial cells which present in the brain. So these can be divided, bone marrow can be divided into different cells. So I made a here a diagram that show bone marrow sinusoid, and bone marrow, this is the medulla of the bone. So these are sinus endothelial cell, which is I'm showing here. For example, here is the neutrophil present, and maybe here is the erythroblast cell, and here is the megakaryocyte, which have appendages dangling into them, and later on when they mature from the sinus, they go into the blood. Here how we're gonna do that? If a patient have a problem in the bone marrow, so we gonna do the bone marrow transplantation. Bone marrow transplantation, how we're gonna do that? We give the injection of the bone marrow into the vein, and eventually the bone marrow cells settle down into the bone marrow, not in the blood. They will not remain in the blood. So lot of problem occur in the bone marrow. So we're gonna discuss these problems into the next slides. So one is the aplastic anemia. What is aplastic anemia? So the condition in which peripheral circulation show that pancytopenia, and bone marrow show hypoplasia. So what is pancytopenia? Pancytopenia means that in the circulation, RBC, WBC, and platelets are reduced. So in the blood circulation, if the RBC, WBC, and platelets are reduced, we say that the condition is called pancytopenia. So in aplastic anemia, pancytopenia occur. The second thing is that bone marrow show hypoplasia or aplasia. Hypoplasia means have a low division of cells, or aplasia with no even show no any cells. So These two condition if present, we will call that person have a anemia, which is called aplastic anemia. Very easy. We already discussed that pancytopenia, that in the circulation RBC, WBC and platelets are low, so that our condition is called pancytopenia. And bone marrow show hypoplasia or aplasia. So bone marrow have a abnormal cell or maybe no cell. What are leukemias? Leukemia actually is the malignancy uh, of hematopoietic precursor cells, which like stem cells, hematopoietic precursor cells and stem cells, which excessively proliferate, and that proliferation is abnormal. If abnormal proliferation, excessive proliferation occur, if abnormal excessive proliferation occur, that is condition is called what we call as leukemia. Here we will discuss about the formation of RBCs. We already studied the first lineage. They have a three cells: erythroid, megakaryocyte and basophil. So these first lineage is erythroid. We already studied that from how they gonna mature and form the RBCs. We will study that. So first is proerythroblastic cells we have here. So proerythroblastic cell have a 20 micron and have a basophil cytoplasm. So we will eventually first before I going to explain this all diagram, first we have to remember that these size of these cells, you know that this cells is big, this is small, and this is very small. This is 20 micron, this is 17 micron, and this is 14 micron. So eventually this is 10 micron, and this is maybe 8 and 7 micron here. So we have seen that gradually these cells are reducing its size, and what is happening that the cell's color is here is blue and eventually here is red. So cytoplasmic color is also changing. So while they are maturing and come into the peripheral circulation as a mature RBC. So we will see that first cell is proerythroblast. Proerythroblastic cells are big cells, 20 micron cells, and they have a big cytoplasm, which are blue color cell. So this is called basophilic strain it takes. So this proerythroblastic cells eventually divide into the early normoblastic cells, which is also basophilic, but it's have a smaller size than proerythroblastic cell. So after that it will divide into the intermediate normoblast. We have to remember that this intermediate normoblast are multi or polychromatic normocytes. Multi, or what is multi or polychromatic? They have a blue and also red stain in them. So that's why they have a color of poly or multichromatin. So multichromatic cell. So lead normoblasts are totally eosinophilic, means it take red stain because nucleus is now getting smaller and cytoplasmic is maturing, and this red stain, from where its red stain come from, this is hemoglobin. Actually, hemoglobin, we know that RBC have a hemoglobin which carry oxygen and supply to the all part of our body. Even in single cell we take oxygen. So from where oxygen come, they carry hemoglobin carry that oxygen. So the red color is from the hemoglobin. So after that it mature into reticulocytes. Maybe reticulocyte, we can say that that is a 8 micron here. After that it get more smaller and more maturation of the cytoplasm, and nucleus is totally gone here. So reticulocytes have uh, absence of nucleus. They don't have any nucleus there. After that they come into the circulations, peripheral circulation, and fully mature we will call RBCs, which is 7 to 8 micron. Very important. So what if the problem occur in RBC's maturation? The process we already study above. That process is the problem which we are discussing, that megaloblastic macrocytic anemia. So the above process of maturation disturbed due to lack of B12 and folic acid. So B12 and folic acid, if body lack of B12 and folic acid, nucleus of the RBCs don't mature. So RBC have a maybe less hemoglobin, or maybe our nuclear material not mature, and RBC don't get rid of nucleus. So that is one condition, that B12 and folic acid have impact on maturation of nuclear material. The second is maybe thyroid hormone. Thyroid hormone, due to lack of thyroid hormone, and amino acid also need in the maturation of RBCs. So that's all for RBC. So now we will go our next cell, which is megakaryoblast or megakaryocyte, and which give rise platelets. So here we will discussing about the platelet formation. This is a megakaryoblast, that is multinucleated cells, have appendages like here. And this is bone marrow sinusoid here. So they like putting appendages into the bone marrow sinusoid, because these endothelial cells have a gap in between them. So when these appendages is cut off and they divide into small pieces, those pieces of megakaryoblast are called platelets. So that's a process, just simple process of platelet formation. So basophil, next our cell is basophil, which is also called mast cell. So that is derived from connective tissue stem cells, and they are like their other name is for is called basophil, or they can be said that they have a sister of basophil. Mast cell also have IgE protein like basophil. So next is our monocyte, big eater. We already discussed that, macrophages. So, monocytes in the blood capillaries or circulation known as monocyte, but in the tissue they are called macrophages. During the inflammation, they come into the tissue. If they are in circulation, they are called monocytes, and if they outside the circulation, they have a different name. One name is macrophages. So how they have a different name? Like we say that macrophages derivative, they have a different name in different tissues. So that's very important concept, we have to remember that. First is monocyte in the central nervous system, they are called microglial cell, and second is this is a liver. In the liver they are called Kupffer cell, and in the lungs they are called alveolar macrophages, and in the liver in the spleen and lymph node they are called dendritic cells. And in the kidney they are called mesangial cells, and in the skin they are called Langerhans cells. In the bone they are called osteoclastic cell. That's very easy. They have a different name in different tissue. Just we have to remember that. In some books they have written their with different names, so we don't have to confuse their formation of granulocytes or neutrophil. How the granulocyte, just actually granulocyte have three kind of cells, like basophil, eosinophil, neutrophil. Monocytes also have granules. So but here we basically just say that granulocytes, they are just divide into neutrophil, and they are part of like neutrophil. So how the neutrophil is formed, in this slide we will be discussing that. So first is myeloblastic cells. Our myeloblastic cell, they give rise to the promyelocyte, and then from promyelocyte they give rise to the myelocyte. After that granulocytes, and then it develop into the neutrophil. So that's very easy. Just we have to remember the sequence of uh, those different name of cells. But cells are eventually become neutrophil. So granulopoiesis occur at 65% in the hematopoiesis, and erythropoiesis occur 20%, and lymphopoiesis occur 10%. Why the granulopoiesis occur more? Because those are the cells, neutrophils, which come first and fight in the inflammation. If there is a problem in our system, so first for example in the during the inflammation, they come first. That's why they have our body need more granulopoiesis, i.e. neutrophils. So monocyte and eosinophils have 3:1 ratio. That's we have to know that. So lifespan of different cells. So different cell lifespan. So first RBC have a 120 days lifespan. After that they die. Our spleen will broken down into pieces, and we use for the different purpose those amino acids, different compound of the RBCs. So RBC's lifespan is 120 days. So platelets lifespan is 7 to 8 days, and neutrophil lifespan is 24 to 48 hour. And after that but in fight these lifespan will shorten that into 6 to 7 hours have a lifespan. And memory lymphocyte have 20 to 30 year. the longest lifespan. So that's it. Thank you very much for seeing my lecture and giving me your precious time.